Good evening and welcome to our COVID-19 update. I am Ladi Akiriduluale. Here are the highlights for this hour. Federal government approves 2.3 trillion naira Nigeria Economic Sustainability Plan to support coping with COVID-19 challenges. Residents of various states continue to defy COVID-19 prevention guidelines and protocols. And United Kingdom economy to contract by at least 10%. Italy, France, and Spain will be worse off. The Federal Executive Council, FEC, presided over by President Muhammadu Buhari, today approved the Nigeria Economic Sustainability Plan as recommended by the Vice President, Professor Yemi Oshibajo's committee. The 2.3 trillion naira stimulus plan is to support the Nigerian economy in the face of disruptions and challenges in the aftermath of the COVID-19 pandemic. The Minister of Finance, Budget and National Planning, Mrs. Zainab Ahmed, says the Council approved the report of the Economic Sustainability Plan Committee. She said the committee, made up of a number of cabinet ministers, held extensive consultations with the National Assembly and the Economic Advisory Council, as well as state governors. The goal of the plan is to create jobs, put money in the economy, hopefully stop it slipping into recession, as well as support small businesses and prioritize local content. It is a 12-month transit plan between the Economic Recovery and Growth Plan and the ERGP successor plan currently being worked upon. According to Mrs. Ahmed, the total package that we presented today is in the sum of 2.3 trillion naira. 500 billion naira of this is a stimulus package that is already provided for in the amended 2020 appropriation fund. These are funds that we have sourced from special accounts. We also have 1.2 trillion naira of these funds to be sourced as structured low-cost loans, which are interventionary from the Central Bank of Nigeria, as well as other development partners and institutions. Moving on to the COVID-19 pandemic itself, some traders dealing in non-essential commodities in the Edo State capital, Benin City, have returned to their business places ahead of any directives from the state government asking them to reopen their operations. One of the traders explained that he had undergone screening for COVID-19 and felt fit and ready to resume business. A transport line operator in the state who awaits government's review of the directives on interstate travels makes suggestions on how passengers could be protected when the ban is eventually lifted.
Goods on display at shops on Mission Road in Benin City, the Edo State capital. The items do not make the list of essential commodities. One of the traders gives reasons they've reopened their businesses even before the state government has directed them to do so.
With the directive of the government from our leaders here also, they said we should go for tests. So after going for tests, it will not open. But those that have not been tested will not open.
On Forestry Road, also in the state capital, some businesses are in operation. A COVID-19 screening center is situated nearby.
Don't join the group or the team that said there is no corona in Nigeria. There is.
The number of traders who have turned up voluntarily to be screened is said to have increased recently.
People in the market, the traders, they are coming out for screening. According to the instruction given, that they must be screened so that when the market reopens, so that they will be able to sell. After the screening, then we can now give them a note, a written note. They go to Ropota Hall to collect a clearance card so that they can use it to open market when they finally reopen the markets.
As to the interstate travel lockdown, one of the transport line operators in the state maintains that his company has been compliant, giving suggestions on how to operate when the ban is eventually lifted.
If the government open the road, we will now buy this thing you used to test, so that if any passenger is traveling with us, we just have to test the temperature. Then after that, he or she must put on a face mask before we allow them to travel. As for me, I will suggest that instead of 3 on the seat, let's make it 2. At worst, we say, okay, just put little thing on top of the money so that we will not run into the loss.
According to the Edo State government, the COVID-19 pandemic is expected to peak around the end of June 2020. And for it, while measures are on to reopen the state's economy, that would only be done after the 28th of June. Jessica Lugose, Channels Television News.
From the south to the southeast, where with the increasing number of confirmed positive COVID-19 cases in Abia State, which involve a total of 252 confirmed cases, 93 patients have so far been discharged after undergoing treatment at the isolation centers. 3 died before results were released, and there are 156 active cases as of date. Abia State Specialist Hospital and Diagnostic Center has commenced laboratory analysis of the suspected COVID-19 samples collected with the state. And this followed the nod given to the center by the NCDC, who also trained its staff and supervised the analysis of the initial test samples, with results tallying with that obtained at their facility in Abuja. Moving on to Katsina, the state chapter of the Nigerian Medical Association chairman, Dr. Muhammad Nafiu, in reminding residents of the existence of COVID-19 in the state. His warnings come on the heels of the fact that most residents have, after the ease of lockdown order by the state government, shunned safety protocols and guidelines in containing the spread of the virus.
Businesses and gatherings at both worship centers and public places have since resumed in Katsina State. From the obvious, residents may have considered the easing of lockdown as signaling a slow in the spread of the virus, or at the very least, something not to worry about.
I only wear the face mask when I'm interested, but whenever the weather is hot, I dare not try it because it will disturb my breathing.
A medical practitioner who still witnesses a lot of people come down to the virus can help but speak to the dangers of letting down of guards by residents.
People think with the lift of the lockdown, it's like the coronavirus too is gone. That is psyche, you understand? But the coronavirus is there, and that actually contributes a lot to what people feel as to approach in the infection prevention and control. So you rarely see people with masks because, of course, the lockdown has been eased or the lockdown has been lifted, and people will think, oh, the coronavirus is gone. No, the humans respond to the laws that ease or lift the bans, but not the virus. So there is more likely community spread, which is what we're having.
Earlier this week, the national coordinator of the Presidential Task Force warned against the dangers of a conspiracy theory and non-compliance. The numbers this week are also indicative of a rising tide. Just when will enforcement become a national strategy may just be all that will be required to get people to shape in.
In the South, to ensure that number of persons positive for the coronavirus in Bayelsa State does not increase, medical practitioners are calling on the Bayelsa State government to put more measures in place to curb the spread of the virus. Our correspondent, Deborah Timewood, has more.
The conversation amongst residents of Bayelsa State regarding the coronavirus is gradually shifting from the daily increase in the number of persons infected by the coronavirus in the state to the question of if the Bayelsa State government and its COVID-19 team is doing enough to curb the spread of the virus in the state. Some medical practitioners in Bayelsa State are of the opinion that the state government needs to do more.
Government has to look for ways of restricting movement of people. Then secondly, the guidelines put by the NCDC, everybody should wear a face mask. In fact, the Presidential Task Force right now encourages the use of face masks. Ensure you wear a mask when you're going to anything outside your house. Even at home, you are not sure of the people you are staying with. You can also wear a mask. Then those are already infected with these numbers. The isolation centers are getting filled up. We need more isolation centers. We need centers where we can even keep people having positive cases and telling them to go to their houses and get isolated. It's also not good enough, because these are people that go back to their families. They live in sometime in a room with so many persons. That's also not good enough. So if we have bigger isolation centers, these people should be managed by healthcare professionals. And people have to be constantly reminded that the virus is increasing. There's community spread. And if this is not contained, there will be a disaster for the state.
In the past few months, the Bayelsa state government has been doing all that it can do to contain and curtail the spread, especially with respect to community spread and all that. The Bayelsa state government is doing enough, but I also believe that worldwide there's more that can be done. All we can say is, as the spread continues, there should be more funding. We would also, with the cooperation of the members of the public, we believe that we'll be able to fight COVID-19 to a standstill.
The COVID-19 awareness campaign undertaken by the Bayelsa State COVID-19 Task Force, #MaxUpBayelsa, is clearly not working, as residents of the state are seen in... The conversation amongst residents of Bayelsa State regarding the coronavirus is gradually shifting from the daily increase in the number of persons infected by the coronavirus in the state to the question of if the Bayelsa State government and its COVID-19 team is doing enough to curb the spread of the virus in the state. Some medical practitioners in Bayelsa State are of the opinion that the state government needs to do more.
Government has to look for ways of restricting movement of people. Then secondly, the guidelines put by the NCDC, everybody should wear a face mask. In fact, the presidential task force right now encourages...
Thank you, Deborah. Let's go to Bauchi State, where the government there says all plans are in top gear to tackle all forms of infectious diseases, including COVID-19. Our correspondent, Hajara Aliu, gives us the update from that state.
Bauchi State, before the outbreak of coronavirus, was quite familiar with the response and management of infectious diseases. The state battled yellow and Lassa fever. There were over 100 cases of Lassa fever reported in the state, and the last patient of Lassa was only discharged a week ago. The first response to the outbreak of coronavirus in the state was the establishment of the Task Force Committee on COVID-19 and Lassa fever. And since then, the strategies have improved, expanded, and sometimes changes based on the trend of the infectious disease.
Well, we already have emergency operation center even before the coming of the COVID, and that emergency operation center is tackle issue of diarrheal diseases, issue of polio, and other emergencies. We tackle it, even the response due to Lassa yellow fever, we tackle through the emergency operation centers, where we carry out active case search and then investigation and find out who are involved, and then we'll be able to handle and take care of the infection. Now, with the coming of the COVID, the state government decided to create another emergency operation center in the Ministry of Health, where we are looking at all aspects of emergencies, including the emergencies due to our pregnant mothers and others. We are not thinking about only COVID. And then we have the case management, which actually treat, where we are different in Bauchi. You can see the number of deaths in Bauchi is quite different from others, because we actually go for active case search. We treat the patient immediately. We give them good food. We fight food. We use food to fight corona in Bauchi State. That's what the governor said. He is also one of the first victims of coronavirus. So it is the food that fight and increase immunity.
Out of 167 billion naira initially budgeted for the year 2020, the health sector got 15% allocation. That has met their budget declaration. But now the budget has been reviewed and slashed to 128 billion naira. But the figure for the health sector remains unchanged, since the state government has now decided to focus more on health, education, and agriculture as part of its response plan to COVID-19. The revised budget is before the State House of Assembly for considerations. From Bauchi State, Hajira Aliu for COVID-19 updates.
Thank you, Hajara. It's been 119 days since the first case of COVID-19 was confirmed in Nigeria. From the index case recorded in a 44-year-old Italian citizen to the over 21,000 confirmed cases now in 35 states, plus the Federal Capital Territory, Nigeria has been described by health authorities as being in the active community transmission stage of the disease. But how did the country get here? Let's take a look at the timeline. On February the 27th, we had our first confirmed case. And then on March the 28th, the confirmed cases had jumped to 97. Thereafter, we had moved on to April the 28th, where the confirmed cases were now 1,532. On May 28th, we had 8,915 cases, while on June the 23rd, we had 21,371. Well, joining us to take a look at this is the chairman of the Association of Public Health Physicians of Nigeria, the Lagos State chapter, Dr. Tolu Olufunlayo. Dr. Olufunlayo joins us via Skype from the Yaba area of Lagos. Dr. Olufunlayo, it's a pleasure to welcome you once again to the program.
Thank you, Ladi. Good evening. Thank you for having me.
If you take a look at that timeline, we seem to have started off slowly and then accelerated somewhat, because now we're getting cases in the triple numbers. And we are said to have moved to the active transmission stage. But even as we speak, the efforts to control the spread don't seem to be working.
Well, thank you. I didn't quite get the last statement you made, but you were saying something about the efforts don't seem to be working. Could you repeat your question, please?
What I said was that in spite of the fact that we are seeing the numbers rise, in some cases dramatically, yes, the efforts to prevent it don't seem to be working.
Well, we can't really say that. I'm sure that if we hadn't put any efforts in place, we would have seen much higher numbers. Remember that the model that we had about 2 months back showed that in Lagos State, for example, we could be looking at anywhere between 90 to 120,000 cases. And most of the modeling that has been done concerning the number of cases for COVID-19 have not really been reached. We're actually far below what we had anticipated. And we're not even, the cases didn't start. And that was largely because we put in the lockdown measures, which slowed the rise of the curve and gave us some time to think about what we wanted to do and think about our response. And thus, we do have a response in place. Remember, this response is both from the side of the government and its agencies, as well as the personal responsibility on every Nigerian citizen. So there are a lot of facets to this response. And I must say that there are quite a lot of things going well for us. And we just need to harness what we have in place to be able to have even better containment of COVID-19 in Nigeria.
I hate to sound like the cynic in all of this, but that's what I'm paid to do. There are those who will say that the numbers you're referring to are also a function of the number of tests that we have done. At the last count, the number of tests that Nigeria has done is just hovering around the 117,000 or thereabouts mark.
Yeah.
But if you take, if you take that in context with how many positive cases that we've had, you're looking at about 30% in terms of the infection rate as a percentage of the numbers. So if we're looking at that, if we test more, we're going to get more. If you use South Africa as an example, South Africa has tested almost 1.4 million people, and therefore it has had more than 100,000 positive cases. If you take that as the background, are we not simply delaying what would appear to be the inevitable because we aren't testing as much?
Oh, well, yes. One of the major reasons why we're seeing higher numbers is because we're testing more, and we have to test even much more. We must test, trace, and treat. But I must say that if there were no cases, no matter how much we test, we wouldn't find them. So the fact that we're finding cases means that we have a high number of infections. Of course, the number of confirmed infections is definitely far below the actual number that we would have in the community from what we can see. And that is why we have to test more.
But if you take a look at it now, because this is on the other side of it, people like you and others in the process have talked and talked and talked and talked and, you know, explained why this is important, how contagious this is and so on. But yet every day our reporters go out across the country in virtually all the states and the report is the same. The compliance levels are nothing to write home about. The PTF says the same thing. Some more candid governors are saying the same thing. Some are even threatening to reimpose the lockdowns. Where is the problem? I know I've asked you this before and you talked about something, but I have to ask you again. Where is the disbelief or the disconnect coming from?
Well, the disconnect comes from many sources. It's all about human behavior. And there are so many factors related to this. But I must tell you that, one, we have a health system that was weak before we started. So it's difficult to harness and move and get our plan going. Secondly, there's this large distrust between the government and the people. So when people are saying something from the top and the people hear it, they're going to see it in many different shades, many different colors. And this is the reason why the community must be well engaged. We have done some work in this area, but we need to do much, much more. And we are doing it. I must tell you that we have to do it. Without this, we're not going to see that much success. I hear people talking a lot about enforcement. Yes, there will be need for enforcement in some areas, but I can tell you enforcement will not get us to where we want to go, because largely enforcement will only bring what we could call eye service. People will only do what you want them to do. For example, if you say you must wear face masks in public places or else you'll be fined or you'd be arrested. When they see the police person coming, they would put on the face mask. But when they pass the police checkpoint, they say, I don't believe this. So we have to get them to want to be part of this COVID-19 response. And that is why we have to take it down to the grassroots, down to the communities, get them involved in reporting COVID-19. First of all, get them involved in understanding what COVID-19 really is and to understand that it is real. I know people keep saying, oh, even on your news report tonight, people were saying, I have heard about COVID-19. I know it's real in other countries, but not in Nigeria. Now we have to sit them face to face, one-on-one, and ask them, why do you not believe? What do you, we need to get the community to be actively involved in this. And there are some states in which this is happening. And when you go to such areas, you will find out that the response would be better. They would better take whatever it is you ask them to do. They will even be the drivers of these changes. So I still maintain that we need to get to those are grassroots structures, the community development associations, the ward health committees, the local government health.
We seem to be having some...
And trusted people to speak.
Okay, better. Dr. Olufunlayo, I must thank you at this point. Dr. Tolu Olufunlayo is a consultant public health physician there. She's also, of course, the chairman of the Association of Public Health Physicians of Nigeria in Lagos. Thank you so much. You joined us via Skype from the Abia area of Lagos. Thank you so much. We'll take a break, and when we come back, we'll talk about the situation report with COVID-19 as it stands today. Thanks for staying tuned. Welcome back to our COVID-19 update. Let's bring you the latest situation report from the Nigeria Center for Disease Control, the NCDC. As it stands, the total number of confirmed coronavirus cases in the country is 21,371. And this was recorded across 35 states plus the Federal Capital Territory out of over 120,000 samples tested. 7,338 patients have been discharged, leaving the number of active cases at 13,500. Sadly, the death toll is 533, and this puts Nigeria's case fatality ratio at 2.5%. The demographics have remained the same for over 2 months, as the virus has affected more men than women. 67.33 in percentage terms, and the most affected age group is between 31 and 40 years. We're witnessing less transmission on cases with travel history at 2% following the travel bans, but it's now more cases of unknown exposure, otherwise called community transmission phase. Over to the general fact sheet data. It gives you a breakdown of the states, the top 5 being Lagos with over 9,000 cases, followed by the FCT with 1,605. Next is Kano with a tally of 1,190. Oyo has 1,055, and River State accounts for 930 cases. Let's expand the conversation, shall we? With me in the studio is another public health physician. This time it's Dr. Joke Adewale. Welcome. Thank you for being here.
Thank you.
Let me start off on the note. Why do you think this is affecting more men than women, would you say? I mean,
yes, I have no scientific evidence right now, so I can't speak from that stats. I can only say that maybe because men are daring, they tend to wave these measures as signs of being masculine. And they pretend as if they are immune.
Oh, okay, but if we take that as the starting point, the report from across the country is that there seems to still be very high non-compliance, generally, with the guidelines. And just before the break there, I was talking to Dr. Olufunlayo, and it still seems difficult to understand why, even in spite of the rapid increase in more recent times in the number of even confirmed cases, people are still saying they don't believe that this is real, and that therefore, you know, people are saying theirs, but they're going to go on with their lives as close to normal as possible, meaning no face masks, no social distancing. On my way to work today, I saw a truck full of people, all of them without face masks, not observing social distancing. And when I tried to, they said, no, it's you people, it's you, you know. And this is 4 months down the line. How come?
Well, we can't still deny the fact that many people, it's just a few, it's just a very tiny percentage of people, of the actual population, that has contracted the disease. Actually, some have contracted it, but they did not know. Some had anosmia, that's inability to smell properly.
Right.
Some had fever, and they waved it off as malaria. And you know that more than 80% of COVID cases are asymptomatic or mild to moderate illnesses. And it's a viral infection, most likely to resolve. So they are yet to see the overwhelming importance, because the mortality is still very little, 2%. Right. What we can only do is to continue to push the awareness. And also, you know, in a bid to protect the people with the comorbidities, the elderly, because those are the ones that will really suffer. I always say it that if you're a person in Lagos, then there's a fair chance you've come across somebody with COVID-19. There's a fair chance. And what has probably protected you is your immunity or your self-consciousness or your protective measures. So safe to say, they're just like, you know, my economy first, my livelihood first, whatever. If COVID comes, let it come. I'm going to be fine. I don't know anybody that has died from it. So that's the way it is. We can only continue to push more awareness. You know, awareness can never be enough in a situation like this. You keep on telling people, showing them survivors, showing them stories. Because right now, like you said, everybody's just, it's a free-for-all, like, as far as they are concerned. Let COVID come. Didn't we overcome malaria?
But it does appear from everything people like you have said, COVID isn't malaria.
It isn't.
And the effect it could have is more devastating. I mean, if you take, I remember that the last time the Presidential Task Force briefed, its chairman cited Brazil as a country they were looking at very closely, because its population is about the size of Nigeria's and the trajectory and all of that. Brazil is a terrible example.
Very.
Of what could happen.
Very. Considering the prevalence of coronavirus and the, you know, the daily incidents. Well, suffice to say, it's not as if, you know, the government that is saying it is very important. It's the same government easing the lockdown. I can't blame them, though. You understand? So people are balancing these things. You say COVID-19 is serious, can cause deaths, but we are free to go to our markets. We are free to, in fact, in a matter of time, they will say we can go to our churches. People are already preparing, you know.
To go back to school.
To go back to school, exactly what I was about to say. So people are looking at these measures. It seems as if now, just protect yourself and, you know, increase your immunity. This COVID-19 is not a big deal. You'll be fine. It's obviously a big deal because it is stretching our health facilities, it is causing worsening economy, it is causing worse outcomes in people that have comorbidities like asthma, hypertension. But right now it's a free-for-all, and in the language of the common Nigerian, we can only pray.
Now, but if you take a look at it, and that was part of what I was raising with Dr. Olufulayo as well, there are those who say that as scary as possibly the rate of increase is more recently, that's only a function of the number of tests that we're doing. And that number of tests is still small compared to the population. And if given what you just said now about so many people walking around who don't know they have it, and because their symptoms are mild to moderate, they may never actually lie down where everybody would know. I'm almost afraid to ask, should we even be doing more tests? What could we possibly find if we do more tests?
Knowledge is always power, at least to knowing exactly even whether they are mild, they are asymptomatic, knowledge is always power. It gives you better decision tools to make, and to also say, at least this is what is going on. But the government is really trying their best. Laudable efforts, NCDC, but I have to tell you, this is a precarious situation. I'm making light of it and smiling. But, every percentage, whether it is 2% or less or more, these are people, real people. In addition to the morbidities from non-COVID cases, the strain on the health system, what I can just say is that the situation is precarious. The best people can do, the best the government can do, they can increase the awareness, and the best individuals that can do, including those that are watching this station right now, is to make sure that they are very self-conscious and aware. The fact that you're my best friend does not mean I should throw myself about and start talking right in your mouth. We shouldn't lose sight of because now when push comes to shove, it's not about the government, it's about you and your family, how you feel, the emotional pains you go through when a member of your family is sick or about to die. So it's fine, we can say the government is this, the government is that. Now it just boils down to you. Everybody, personal responsibility, because we are all free to go out. We're all free to do whatever we like now. So it's your choice to use a mask. It's your choice to wash your hands. It's your choice to eat a balanced diet for immunity, because most likely your neighbor has... please, Mr. Ladi, if they test everybody, most likely a lot more people will have COVID-19. So like I was saying on my Twitter page the other day, COVID-19 is not something you can run from anymore. Fine, protect yourself, but just accept that it is around you. Even those that have not been tested most likely probably have it. If you have that mentality, you just be conscious, eat well, and pray to God.
I shudder when you say that. Dr. Ajoke Adewale, thank you so much for your time.
Thanks a lot for having me.
Thank you so much.
Thank you.
The Imo State Governor, Hope Uzodinma, has vowed to arrest and prosecute anyone found flouting the protocols and guidelines put in place by the state government on the temporary easing of the lockdown in Imo State. Eitokwe Kutei has more.
Worried about the recent surge in the number of COVID-19 cases in Imo State, Governor Hope Uzodinma has threatened to arrest and prosecute anyone flouting the protocols and guidelines put in place by the government to combat the coronavirus disease. The governor disclosed this earlier today at the government house in Owerri during his routine COVID-19 briefing with journalists.
I must make it clear that all safety measures must be adhered to. Henceforth, any person or group of persons caught in breach of any of the safety measures will be promptly arrested and prosecuted by the mobile court. Security agencies have been charged to be on the lookout for those refusing to observe social distancing or to wear face masks, all of which are compulsory by law.
The state has recorded 3 new cases in addition to the 243 confirmed cases earlier announced by NCDC, which brings the total to 246 confirmed cases of the coronavirus disease in Imo State. From Owerri, the Imo State capital, Eitokwe Kutei, for COVID-19 update.
Let's go to, thank you first to Eitokwe Kutei. Let's go to the United Kingdom, where the International Monetary Fund has said the global economy will take a $12 trillion hit from the COVID-19 pandemic after slashing its already gloomy growth projections for the UK and other developed countries in 2020. The UK economy is expected to contract more than 10% this year, followed by a partial recovery in 2021. That would be one of the most severe declines, although not as deep as the forecast for Italy, France, or Spain. The previous April forecast was a 6.5% decline for the UK. Our correspondent, Juliana Olayinka, now reports on the update from there.
Hallelujah. A cheer of jubilation in the House of Commons yesterday afternoon, as British Prime Minister Boris Johnson confirmed speculation that the hospitality sector in England can finally open for business after 3 months of lockdown.
Given the significant fall in the prevalence of the virus, we can change the 2-metre social distancing rule from the 4th of July.
The measure has been described as a purely political decision. Last month, the country's GDP tumbled by more than 20%. And the latest polls suggest that Britons were getting fed up with the government's handling of the pandemic. Populist leader Boris Johnson is known to adhere to public opinion. But at what cost? The country has been battered by COVID-19, which has taken the lives of almost 50,000 people. Downing Street's first attempt at a contract tracing app hasn't been as successful as they had boasted. Last week, the Health Secretary, Matt Hancock, made a major U-turn on the technology, admitting it was flawed, and they would switch to a model being developed by tech giants Apple and Google.
Germany, app working 15th June, 12 million downloads, 12 million downloads. Mr. Speaker, I checked that overnight. 12 million is way beyond. The Health Secretary said we'd have the app by mid-May, presumably on advice. The Prime Minister said we'd have it by the 1st of June. Now the government ministers say it won't be ready until the winter. We've spent 12 million on this. Other countries are ahead of us. When are we going to have a working app?
No time soon, it seems. Even though the government has insisted that the test and trace programme is key to reopening the country, for now, the countdown is on for July 4th. The date will no longer be a holiday, celebrating independence of Britain's long-distance cousins. Juliana Olayinka, Channels Television News, London.
Well, Juliana joins me now, Vice Cap from London. Good evening, Juliana. Well, July 4th may not be celebrated as the Independence Day of the long-distance cousins, but there is going to be some kind of celebration because people will be free to hit the pubs, from what I understand.
They will absolutely be celebrating, Laddie. And I'm sure, I started off my report with that hallelujah, congratulations reaction when Boris Johnson, the Prime Minister, reaffirmed yesterday that, yes, July the 4th will allow the hospitality sector to open. And of course, after 3 months, considering that Britain is a service-based economy, 80% of their GDP is reliant upon these services. There were cheers of jubilation, but as I also said, some of that jubilation is caution because we have really struggled. We don't have a test and trace system that's completely up and running. We don't have this test and trace app, which Prime Minister Boris Johnson said that we would have by the 1st of June, even though the numbers are dwindling. We are still sometimes seeing more than 100 people every day dying of COVID-19. And it's clear to me from listening to some of the scientists that have been speaking on British media throughout the day that this decision by Prime Minister Boris Johnson is purely political, purely economic, and there are concerns that there could potentially be a second wave hitting British shores anytime soon.
Well, the British Prime Minister's concern would be genuine, even if it was based on politics and economy. He was elected on the platform of Brexit, and then COVID-19 got in the way. And I think only yesterday was the 4th anniversary of the vote in the UK that led to Brexit. So 4 years on, they're anxious to get this behind them, but then COVID-19 is there. How much of a risk is he taking, though? Because if you talk about the percentage slash being 10% forecast now, with the economy opening, is that likely to be lighter, or is it likely to be heavier?
Gosh, it's a tricky question, and I suppose that's a question that Prime Minister Boris Johnson is gambling on. You know, I heard the statistics you were giving about GDP in Britain, and it has been particularly poor. You know, losing 20.4% of your GDP in 1 month is absolutely crippling. You know, we've been relying upon these services. We do know that even though Prime Minister Boris Johnson has slashed the social distancing from 2 meters to 1 meter plus, there are still some businesses that are saying they will struggle to open. I think what's really helped the British economy and the British people is this furlough scheme, which means for the past 3 months, the British government have been basically paying people's wages, but this cannot last forever. It will taper off. So what a lot of economists in Britain are expecting is that when it comes to the winter time, a lot of firms will be letting a lot of people go. And if you see mass redundancies in a country, are people going to be able to spend that money? That's a big issue. We also heard earlier this week from an analyst at Bank of America, and they were talking about the Brexit 4th anniversary, and they were talking about sterling. Since the Brexit vote, sterling has dropped more than a fifth of its value. Some are even suggesting that it's no longer a G5 currency and shouldn't be compared to the Japanese yen and the US dollar. So there are so many conflated issues. Unlike all of our European counterparts and other countries in the West, Britain has Brexit, and that issue is not going to go away, even if we are able to beat the coronavirus.
Indeed, Juliana, thank you so much for your reporting. And even though you might be going out, please stay safe out there.
Thank you.
Health experts are saying infection rates still have not peaked in many countries. Globally, there are now 9.2 million cases and almost 500,000 deaths. There's continuous worry over Latin America's fight against the coronavirus, as deaths in the region have now surpassed 100,000.
In Latin America, Brazil is currently the worst affected country, having recorded the second highest daily death toll of 1,473 since the start of the coronavirus pandemic. In the last 24 hours, Brazil has seen 1,374 deaths. Brazil is the second worst affected country after the United States, with more than 1.1 million confirmed cases and a death toll of 52,645. Brazil President Bolsonaro has belittled the threat posed by the virus, and a federal judge recently ordered him to wear a mask when in public places. In Peru, more than 220 police officers have died from the coronavirus. The government believes the infections are attributed to officers enforcing quarantine measures in food markets and other public places. Peru has the second highest death toll in the region after Brazil at 8,404 with over 260,000 cases. In the Republic of Honduras, a doctor has described the country's president, Juan Orlando Hernandez, to be in a delicate condition after being hospitalized with COVID-19. He included that the president has had trouble breathing, and his wife, Ana Garcia, has also contracted the virus but is asymptomatic. Honduras has recorded nearly 14,000 cases and 405 deaths.
We're going into the first phase 1, phase 3.
In the United States, top health officials, including Dr. Anthony Fauci, warn lawmakers of a disturbing surge in infections and calls for increased contact tracing. They further announced that President Trump never instructed them to slow down testing and that the U.S. will be able to conduct 40 to 50 million tests per month by autumn. Meanwhile, EU ambassadors are discussing plans to reopen borders on July 1st, and the United States may be among countries not allowed in due to its high infection rates.
From the World Health Organization, physical distancing is one of the most effective methods to limit the spread of COVID-19. You can find more information on how to protect you and your loved ones from the website of the World Health Organization. Our website, channelstv.com, also has the latest news. All you need to do is log on and access the news in health, politics, business, sports, Africa, and around the world, all at your fingertips. Thank you for watching. I am Ladi Akiridoluale. Good night.